Are you a rhetoric person interested in genre theory or disciplinary writing? Or are you a tech comm person concerned with science, medicine, health, or technology? Are you somewhere in between? If so, you'll want to know more about Dr. Scott Weedon. Dr. Weedon received his PhD from Case Western Reserve University in Cleveland, Ohio. His research areas include writing in the disciplines, especially in engineering context, rhetorical genre studies, and the rhetorics of science and medicine. I recently sat down with Dr. Weedon in a Zoom call, and we talked about these topics as well as another one of his research interests, the rhetorics of science and technology. The subfield of the rhetorics of science and technology, or RST, assumes that science and technology are not just material and empirical, but there's a strong rhetorical component as well. Dr. Weedon wrote his dissertation on an RST topic, the ways that engineers use writing to direct their attention and solve problems. He told me, quote, "Any engineer will understand that it's not just a purely technical process that makes something work or doesn't, it's about the consensus of the design team." Dr. Weedon analyzed the way that engineers make meaning through writing. The writing genres that engineers use help writers attend to engineering problems. Dr. Weedon said whether or not a design works is due to much more than just technical capacity. There are subjective and rhetorical factors at play as well. Dr. Weedon also works within the rhetoric of health and medicine, RHM. This field is concerned with the rhetorical factors in health and medicine. Topics researched include gender, the environment, mental health, patient-provider information, and, quote, the biological determinism that is coded into gene research. Dr. Weedon and I discussed two of his academic publications. The first is called Gender-Inclusive Writing for Epidemiological Research on Pregnancy. Co-writing this with an epidemiologist and other scientists, the authors show that of 500 articles on pregnancy that were analyzed, only 1.2% used gender-inclusive language. Gender-inclusive language would be referring to pregnant people as opposed to pregnant women. This fits with much other research in RHM in which undoing static categories of gender is a goal. The second article that we discussed is called Seeing as Making, Mediation Rhetoric in the Ultrasound-Informed Consent Act. Here, Dr. Weedon argues that this law, which requires doctors to show patients seeking an abortion the ultrasound display before the doctor is allowed to conduct the abortion procedure, is a way for political actors to use technology to construct a kairotic moment which intervenes in a woman's health choices. This aligns with what Dr. Weedon sees as the goal for science and medicine, quote, a sort of visual demonstration of phenomena where seeing is believing. The problem is that, as Dr. Weedon says, the rhetorical enactments that make the visual what it is are often pushed to the side. The visual demonstrations work discursively to select certain aspects of reality and deflect others. What is interesting for me in this article is how he approaches multimodality. Ultrasounds are visual, but are constructed of sound waves, and laws are made up of words. We can also think of the first article I described here about pregnant people as concerning multimodality, because the issues he addresses there deal with the intersections of language and the physical body. Perhaps in this case, however, embodiment is a more accurate term than multimodality. Next, Dr. Weedon and I discussed how to choose a dissertation committee. He gave me good insight on how to choose TTU faculty members to work with. Perhaps his best piece of advice was, quote, find someone who can give you the attention you need. I think this is good advice for forming a committee, but also for the people in your life in general. Secondly, he suggested that your chair, quote, doesn't necessarily have to be someone who does exactly what you do, as long as some aspect of your research dovetails with what they do. Next, Dr. Weedon and I discussed what a PhD can do. He told me that a PhD is not a springboard. Instead, it simply removes a barrier. When university committees search for a new faculty member, the committee gets the chance to choose from, quote, dozens, sometimes hundreds of individuals from the top schools that have done all this great work. I also asked Dr. Weedon about the value of a PhD at one's current institution. I asked him about this because I am working on a PhD to either get a sweet academic tenure track gig somewhere or stay at my current institution and cultivate my job security, pay, benefits, and stature. Of course, what a PhD does for a person is situational, but he did offer me the case of Callie Kostelich, TTU's current assistant professor for first-year writing and writing program administrator. Dr. Kostelich was a non-tenure track professor of practice, but worked her way into a tenure track position. According to Dr. Weedon, this was a, quote, confluence of things. We needed someone to continue the work she was doing. We had someone retire. We saved money on doing a search. But we always knew she had the chops to be a tenure track professor. Dr. Weedon also offered, I don't know of a procedure that could have worked for just anyone else. I'll admit this was a hard question to ask, but I felt it was worth it. Dr. Weedon did a commendable job answering it the best he could. I think the real issue here is that there are more PhD graduates than there are jobs. Personally, I feel I have more of a future at my current institution than anywhere else, unless I wind up being a standout applicant at other institutions, which is possible. My main takeaway is that Dr. Weedon reminds me of other faculty members at TTU. Kind of reminds me of Dr. Tom in the way they both apply rhetoric to practical problems with technology. Dr. Weedon, however, seems to be more on the genre and writing side of things, where Dr. Tom seems more all in on technology. Another interesting contrast is Dr. Rice, who also is concerned with technology, but not in the way Dr. Weedon is. Dr. Rice is interested in how technology affords pedagogy, while Dr. Weedon seems more interested in the technologies and how they impact the rhetorical situation, not only in pedagogy, but in other situations as well. I hope this was helpful for you if you're trying to get to know TTU faculty, and I hope to see you around. Have a great day or night or mid-afternoon. Go have a cup of tea. Relax. Take a deep breath. You got this.